Hi, I'm Dr. Steve Silver from University Counseling Services. I'm one of our therapists here, and I also am the alcohol and drug counselor or specialist at our center. You always are welcome to call and schedule a first-time appointment with any one of us, but also me if you did want to talk to someone specifically about some substance use issues privately. While that's available, I did want to make this video for our website so that whether or not you ever reach out to us, you have some good information about keeping yourself safe if substance use in any capacity is part of your lifestyle. So what I'm going to do is I'm going to go ahead and share my screen because I have a PowerPoint. Let me go ahead and start the presentation. And so in getting started with this discussion, I just briefly want to talk about kind of mind-altering substances, behaviors. Humans have had a unique relationship with the world since the beginning of time. We try to alter our perception, we try to enhance our perception, we try to think creatively. And so in various ways, whether it's behaviors or different ways of thinking, we try to alter our experience. In terms of what we're talking about today, obviously substances, I want to talk a little bit about dopamine, which is one of the neurotransmitters in our mind, and it has to do a lot with reward and pleasure and behaviors that get reinforced because of those pleasurable aspects. And so you think of different activities like studying really hard for something and finishing it, and then also getting a good grade back, or having a really good conversation with someone, or exercising, or eating a great meal, or sex. All of these activities release dopamine in our system, among other things. Substances also release dopamine in our system very effectively, and that's wherein lies the issue. Obviously, different drugs affect different people, affect different people in different ways. And so regardless of whether it's an upper or a downer or whatnot, they all release dopamine in some capacity. And substances release a lot more dopamine than these other activities, anywhere from 2 to, I think the highest is crystal meth, which is about 20 times usually higher in terms of how much dopamine it releases in the body. And so I bring this up because this is where things can, for some people, get complicated, right? If someone's mind is more regularly in an ongoing way flooded with dopamine from substances, it can kind of raise the floor of what someone needs to feel pleasure and reward and stuff. So other activities, maybe healthier activities for some, exercise, talking to people, don't feel like with the amount of dopamine that those release, it doesn't feel as effective for people. And so this is where, for some people, substance use can become problematic. In terms of, in my experience, these are just some of the reasons that students drink or smoke or use whatever it is. For some people, it's relaxing. They just want to feel carefree for a little bit. It's not this simple always, right? There can be complications. So I don't put these up here to say like, here are all the reasons you should. These are just kind of what I hear from people. It helps me open up to others, right? It's sometimes even alcohol is thought of as a social lubricant, liquid courage, I've heard it called before. And so for some people, it might actually supplement them trying to connect with people. Students might decide to celebrate, right? If classes or exams are done, they might want to take a mental break or just, party a little bit. Some people might take Adderall, which is actually a form of speed to help them study. And so this is something to be aware of, that it's not just a friend's ADHD medication, it's actually speed. And so definitely it does have the potential to be used problematically. Also, if some of you are away from home for the first time, or you're still living at home, but you're on campus a lot, and so you do have more freedom, this sometimes comes along with some riskiness sometimes, or some excitement, or some experimentation. Also, sometimes without even knowing it, substances help people cope with emotions or stress. Again, later on, that stuff comes back. Sometimes substances intensify it, once it wears off. So again, it's complicated, but this is how some people use it. Substances can also be seen as a rite of passage. With drinking especially, I think in some college cultures and high school cultures, I guess for some, that even this idea of like going shot for shot or drinking someone under the table, the first one to pass out or throw up is the loser, or whoever passes out people end up drawing on them with Sharpies. I mean, if you think about the embarrassment and shame that people go through, it's kind of like this challenge from others to have a high tolerance for substances, which people probably aren't counting their drinks when they're doing that. So that can become dangerous. And then peer pressure. And this is one of my favorites because there's a lot of different opinions on this. In my experience, it usually can show up in a much more subtle way. I remember some commercials from the 1980s about just say no to drugs, and there's a kid like shoving it in another kid's face, like, come on, smoke it, smoke the joint. And maybe that happens sometimes, I'm sure it does, but I think that much more of the time it can be kind of a nuanced pull for some people, and it can be something they might not even be aware of. And I want to talk to you about something, an old experiment that was done in the, I think 50s or 60s, I think 50s for the first time, that actually has nothing to do with substances. So I'm going to tell you about it, and then I'll tell you how I think it relates to this. What they did was they had groups of student volunteers come in, and they would put one subject or person who's not in on it in each trial, and they would put 5 or 6 actors who were pretending to be subjects in the experiment next to them, and they would line up 4 or 5 actors, then the subject, then another actor or two, and they would show them different trials of this card. And what it is this first line, they would just ask them, which of these 3 sample lines does it match? The answer is C. Congratulations if you got the answer. That's not the experiment though. What they did was on some trials, they would go through, and the actors would just answer very matter-of-factly. If we were using this sample card, they would just go C, 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 and the subject would say C. But then on some of the trials, they would show, some other cards that are very similar to this, but they would have the actors very confidently and matter-of-factly say the wrong answer. So say we were using this one, they would go A, 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 and the subjects about 37% of the time actually would say A for different reasons, right? Some knew it was wrong, others thought they couldn't trust their own perception. For those, that's not the important thing. The important thing is that people started to question their own perception and or go along with the group even when they knew it was wrong. And so I bring this up because this kind of stuff can happen with substance use, right? And if you're out somewhere on a given evening and you have midterms in the coming days, or anything that's important, and for whatever reason you've decided not to drink or smoke or whatever that night, sometimes just being in an environment or having people look like they're enjoying themselves without even pressuring you can have a subtle pull. And so I bring this up just so that you can be aware of this social psychological thing that happens to us. We're social beings as humans, and we want to be part of the group. And so that can subtly pull our decision making. And so good to be aware of going into situations where you're trying to limit or count your drinks or whatnot. In terms of alcohol, and I'm going to talk about alcohol and THC or marijuana products today, a little bit about fentanyl, but all the other, if you go to the CSUN website, there's a whole, on the campus disclosure, there's a whole bunch of info about all the different substances, but that would be way too much time for this video. So we're just going to talk about alcohol and THC or marijuana products, and then fentanyl, like I mentioned. So just some of you might have heard this already. Hopefully you know this because it's good practice. But in terms of what one drink is with alcohol, this is it, right? So it's not one cup of whatever you're drinking. It's one big gulp of a mixed drink is not one drink, even though it's in one container. With regular beer, a 12-ounce bottle or can with about 5% alcohol content, that is one drink. That takes about an hour to process, mostly process through our system. Once you get to the heavier beers with about 7% alcohol, the number of ounces goes down because it has more alcohol in it. So then you get down to 8 to 9 fluid ounces rather than 12 as a standard drink. Wine has about 12% alcohol in it, so less ounces, right? So 5 ounces, I've seen 6, so like between 5 and 6 ounces. This one, a lot of people are surprised about. 40% alcohol, so your standard 80 proof alcohol, 1.5 fluid ounces is one drink. So if someone is swigging, from the bottle for a few seconds, that is not one drink. That may be, who knows, 2 to 5 drinks. I don't know. So keep this in mind when you're counting drinks. This is one drink. Oops. In terms of your processing the alcohol. So like I hinted at, our bodies need 1 hour for the most part to process alcohol. Bottom line is, in terms of the law, if you're under 21, you're drinking illegally. We all know that, but we live in the real world where some people are going to drink before that age. And so keeping in mind that, so outside of legalities, right, as we process alcohol, different factors affect our body, right? Age, sex, metabolism, our fat versus muscle content, any medications we might be on. All of these things affect how fast we process alcohol. So it's not an exact science, but all the more reason to really kind of watch your number of drinks if you are out drinking on any given evening or day. What constitutes higher risk drinking, or what some might call binge drinking, is for cisgender males up to, if they're drinking any more than 5 drinks, standard drinks, in a 2-hour period, and for cis females, 4 standard drinks within a 2-hour period. That is once you start to enter that level of drinking, it can become higher risk. And part of the reasons is because you're not giving your body enough time to process the alcohol. It's like a clogged garbage disposal in a way, where eventually, I mean, not a garbage disposal, it'll just kind of, if it's clogged, it'll just keep rising and rising. With humans, if you just keep drinking and drinking, eventually you'll pass out. Actually, this takes me into my next slide. Eventually you'll pass out. That's the second phase, right? So once we're in once you start drinking at low levels, there's the buzzed phase, or the initial phase. This is where euphoria comes in. This is where you're not wildly impaired, but you're feeling it a little bit. You're maybe a little warm, maybe feeling a little fuzzies. The second phase, which is what you enter after you do not give yourself time, or as you drink more before your body has been able to process what you've drinking previously, you enter this second phase until eventually you pass out. And physiologically, we cannot get back to that initial buzzed phase until our body has processed the alcohol. So even if someone is drinking a caffeine drink between alcoholic drinks to keep going, I mean, it's not going to keep you from moving further into this second phase until eventually people pass out. And even after passing out, the stomach is still absorbing alcohol. And so that's why a lot of the times if someone is taken to a hospital, their stomach is pumped with alcohol or other medications, because the body still absorbs it. And this is where it can get really dangerous in terms of people thinking that someone's just going to sleep it off. A lot of the time, yeah, they'll sleep it off. On occasion, there are complications, and they don't just sleep it off. And people have been seriously harmed or died in certain circumstances because they were not taken care of after passing out. So I always like to bring up to people, would you rather get into whatever the trouble looks like to get someone help, or would you rather have kind of a death, be part of your life story? Not that it's purely on you, but there may be many people in this situation, but do you want that to be part of your narrative, that you had this, you had someone passed out and, for understandable reasons, didn't want to get anyone in trouble, but also put someone at risk. So thinking these things over. There's also something called rebound anxiety and depression that can come up for some people. This is not clinical anxiety or clinical depression. This is kind of the body's mood and functioning dipping down below base level after usage. So if someone's mood is elevated when they're using, as it's leaving, their mood might be low for the next 1 to 3 days, even in a really subtle way, or focus might be off a little bit, or they might feel a little anxious. Also, over time, drinking can impact sleep negatively. It actually kind of helps people get to sleep, which is kind of I don't know what to call it, not a misnomer, but it's only the half truth, right? It helps us get to sleep because it's a depressant and it shuts down the brain. However, once our brain wakes up, what's called an excitatory effect happens, and the brain wakes up even if you're not conscious, and you're not entering that deep REM sleep as frequently. Also, alcohol dehydrates you, so making sure you're staying hydrated, not, like I said, not going from alcoholic drink to caffeine drink, but doing water instead. And then in general, just alcohol can mess with our brains, especially for people under 25, because the brain isn't fully developed till around 25, 26. So just being aware of that, and being aware it's like a construction site in progress, and you don't want to mess with it too much, because you want it to be able to be built in a solid way, so that it can stand for a long time. Nationally, you can see all these statistics. I would hope this isn't a surprise to anyone. Alcohol is involved in lots of sexual assaults, other types of physical assault, accidental injuries. Usually they do find alcohol, among other things, in the systems of both perpetrators and victims. This is in no way an indication that because the victim had alcohol in their system, they brought it upon themselves. I think there's a lot of different avenues through which people victim blame, which is absolutely not okay. And so all this is saying is, I think it is important to know, though, when alcohol is in a victim's system, that we as humans, our perception shifts as we drink or use whatever substance more. And so we might not be as able to pick up on if someone's starting to act shady, or if someone is just acting in a very suspicious way. We might not pick up on the cues as much and ask for help from someone else or something like that. So just kind of taking care of yourself in that way. Also, this bottom point, that 1.4% of students reported attempting suicide while drunk. This is not saying that someone drank and it caused them to be suicidal. What this is most likely about is that someone might be having suicidal thoughts or tendencies, but would not regularly act on them. But because alcohol can inhibit judgment and decision making and whatnot, some people might act on those thoughts that they might not otherwise act on. The nice thing about our campus here is that in general, people take care of themselves, and there's a misperception of how much people tend to use. In different ways, they ask people, what percentage of the rest of the campus do you think drinks regularly? And then they ask them, like, do you drink or smoke regularly? They specified, like how many times or whatnot constitutes regularly. When they averaged the percentage of the rest of the campus, or when they averaged people's guesses about the rest of the campus, they guessed that 90% of the rest of the campus drank regularly. When in actuality, people reported their own use, when they averaged it, only about 52%. So even if there's some underreporting, that's still a big gap. That's 38% between what people are actually reporting doing and what they perceive others to be doing. Similarly, with smoking weed or eating edibles, just THC consumption, people guessed that 84% of the campus did regularly. Actual use people's average was 13%, and this is an anonymous, it's called the National College Health Assessment. It's anonymous, so you would hope people would be pretty truthful. But even if people weren't fully truthful and underreported, even add 20, 30% to 13% here, that's still a pretty big gap between what people think others are doing and what people are actually doing. And if you think about what we talked about with those lines and social pull, what we think others are doing, even out of our presence, can affect the decisions we make. So keep that in mind in terms of the fact that other people are using less than what people perceive to be happening out there. And another thing is that 30% of people just reported not drinking at all, just not having it be part of their lifestyle. A positive thing, like I said, is that people at CSUN are taking care of themselves generally when they are drinking. They're doing things like eating before or after drinking. They're not drinking more than 4 drinks in a couple hours. They're staying in groups. They're not, walking around alone, especially at night. They're not going around with people they don't know. They're using a designated driver. So this is very hopeful. Again, with drinking, if you're drinking on a given occasion, plan and stick to your drink count. Take care of yourself in that way. I think I've said most of these, but I'll still go through them. Eat before drinking, use a buddy system, plan a safe ride home, start late, finish early. This means like the later you go out and the earlier you come home, the less time you're going to be out there drinking and opening up the window for some higher risk drinking. Like I said, drinking water or juice between each alcoholic drink, avoiding caffeine, and trying to avoid drinking games, dares, contests, stuff like that, just because the nature of them, by nature, you're not going to be counting your drinks and low-key drinking. So I want to talk a little bit about THC products or marijuana products. So I'm not going to belabor, but I do think that there's some important information just in the past like 15, 20 years that's come up as it's gotten more, what's the word, as THC content has gotten higher. So, you think about back in the 60s, your parents, maybe your grandparents, actually, I don't know. Some of your parents, some of your grandparents, Woodstock, Golden Gate Park, all that kind of stuff. Hippies, right? They were smoking weed. The THC content, which, by the way, the THC content is the psychoactive component of the buds, right? So euphoria, the giggles, all that kind of stuff. So that's the effect of the THC. CBD is the other main component, and that is where you would get, like, for some people it might be medicinal effects of it. So increased appetite, decreased pain receptivity, improved sleep for some. So THC is what gets you high, basically. So in the 1960s, around then, 2 to 5% THC content. So really low, still got people stoned, would probably be considered swag weed in these days, but still worked for people. Up as you go all the way from then up until the early 2000s, people were mixing strains. The scientifically minded cannabis community has come up with higher THC content buds or strains, and so you get 8 to 10%, which is still relatively low, but that's I'm terrible at math, but it's anywhere from 2 to 5 times the amount of THC. Then you get up into the early part of the 2000s and this last decade, and just we're talking about flower, right, or buds, 20 to 36% THC content. So that's pretty high compared to the 2 to 5%. And then once you get into talking about extracts, which is when the THC is extracted, so you get like your waxes, your resins, your edibles have extract from it, or have extract from buds put into them. There are all kinds of products out there, vaping pens, that's extract. And so more and more that's becoming popular. Look at the percentage of THC content, 50 to 9. I've even heard of 99% THC content. So the reason I bring this up is that, it's legal now for people who are over 21, right? So that's one thing. Usually when something becomes legal and the risk gets perceived as less, people's risky use increases because it's like, well, there's no risk. So I think it's important to know that, right? Just because it's legal doesn't mean it's totally safe. Just like with alcohol, alcohol's legal. Look how dangerous it can be in some cases. But also, if someone comes to me saying, oh yeah, I smoke daily, but it's just a plant, it's fine. Yes, in some capacity, but also if someone is smoking regularly, higher concentrations, there's more of a risk to engage in problematic use in that sense. There's more, the withdrawal syndrome is looking more and more similar to opiate, which is like narcotic painkillers or heroin withdrawal. It's not quite as intense, but it is looking more intense than what marijuana or cannabis withdrawal used to look like. And also, they're doing more and more research on links between levels of THC consumption and psychotic symptoms. And it's not saying that they're causing the psychotic symptoms, but that someone might have a predisposition to those, and smoking might kind of make them not latent anymore, may activate them. They're still kind of researching this, but I think it's worth paying attention to that. The content has increased a lot, and with that have come some complications. So in terms of the only other substance I want to talk about, because I think it's huge and it's in the news a lot now, is fentanyl. Fentanyl is a synthetic, which means kind of artificial opioid, which is in that category of like narcotic painkillers, heroin, morphine. It's 50 times stronger than heroin and up to 100 times stronger than morphine. So if you think about how strong those drugs are probably are, right? 50 or 100 times stronger than that. And a lot of the time people are not knowing that they're ingesting it. It's being mixed into things. I just read an article yesterday about someone putting a bunch of fentanyl in candy wrappers, trying to smuggle them through LAX. And so there have been I think there's maybe there are some people who think that it might be like scare tactics or whatnot, but this is a very real thing that's going on. I'm up here in Santa Clarita and up in Santa Clarita County, there's been a big surge in fentanyl related overdoses and deaths. Very, very, like the amount smaller than like a grain of rice can cause an overdose. And so if someone is taking some other substance, some other pill, what someone says is a prescription pill or ecstasy or something like that, more and more people are seeing it cut with fentanyl, among other, I mean, things are cut with other chemicals all the time, but fentanyl has really been causing a lot of disturbing stuff in terms of like overdoses and deaths and fallout from it and whatnot. And so, you know, important to know this. So, I mean, I think it's all the more reason to be cautious about substances in general, but also testing yourself. So if you see here on Amazon or there's a website called dancesafe.org, you can buy fentanyl test strips to test your substances. I think they're usually about $1 a test, if not less. So very affordable, but significantly reduces the likelihood of an overdose. So please, please, please keep this in mind. Like I said earlier, I'm going to go over the potential signs of a problem. The DSM-5-TR, which is kind of the book with all the diagnoses that we use, lists these criteria. And if you meet at least 2 of them, then that would constitute a substance use disorder. 2 to 3 is mild, 4 to 5 is moderate, 6 or more is more severe. So if someone is failing to fulfill responsibilities at work, school, or home, drinking or using in situations that are physically dangerous, an obvious one would be driving. If someone's getting into fights when they drink or use, then that's another situation. Continuing to drink or use despite relationship problems. What can happen sometimes is someone's personality tends to change, or someone's mood tends to change, or they seem irritable, whatever it might be. People might end up pulling back from them in their life. And, you know, in my office, I've had students who are concerned with their own use. I've also had roommates of someone about whom they're concerned, and saying like, I don't want to be around them anymore because they seem like a totally different person. And I've had people who are the ones using themselves say, I don't like the person I turn into when I don't have it. So I want to take a look at this and see if I can take care of myself a little bit better and make some better decisions for myself. Like I mentioned earlier, withdrawal you do not have as much pleasure in those other activities when some people may not have the same amount of pleasure in those other activities if they've been using regularly. So withdrawal from those activities is common. Mood changes, physical or mental issues, spending lots of time thinking about, looking for, or recovering from the substance. The more rent it takes up in your head and your body, the more problematic it can become. And a big sign for me often is previous unsuccessful attempts to cut down use. If someone has talked themselves into cutting down and then kind of rationalizes it and then starts using again at an increasing rate, that's often a sign that something is going on. So in terms of support on campus, or actually before that even, in terms of support for yourself, I think one way of, whether or not substances are part of your life, one way of taking care of yourself that would be good prevention is just making sure that you're regularly engaging in those activities that those less risky activities that release dopamine in your brain, right? Among other positive chemicals, endorphins, all those things you find relaxing, different hobbies, exercise, spending time with different people, going to shows. People get such a rush from going to like big events and stuff like that. So there are other ways of kind of activating this excitement. Like I said, I am at USC, Steve Silver. If you forget my name, you're welcome to call us and say, can I talk to the drug guy? And I promise they'll know who to put you through to. And you're welcome to schedule an appointment with me. This is our website and this is our phone number. However, I'm just realizing that if you're on our website watching this, you've already found your way here. So congratulations. Also, like I said, I can support people in getting set up with other types of support. So there are 12-step meetings in the community, which are non-professional peer support groups that are free. They take donations for like coffee and cookies, but it's free. You do not have to pay anything. You will never be kicked out of a meeting for not having anything to give. Outpatient treatment, which is like you go to a center for some groups or some individual therapy, but then you go back home, you go to work, you go to school. And then for people who really have been are deeply steeped in their usage, that would be your more traditional residential or inpatient program where you stay there, you stay there for a period of time, you sleep there, you kind of take a break from other elements of life. And then there are sober livings, which are not treatment. They're not clinical treatment themselves, but what they usually, it's like a post-treatment thing where you pay rent and everyone in the house has, it's not a perfect system. People use in there just like in rehab sometimes, but the idea is that you're living in a sober environment where your daily life, you're helped with daily, or you're helped with structure of your daily life, and support one another and go to meetings together. So I can support someone with any of these. Another thing is if you've just been in treatment and you're looking for just a way to come back to the ground as a student, or if you take some time off from school to go to treatment, reach out to me. Even if you have an ongoing therapist, reach out to me, see if there's anything that we can do to help you return to campus or come up with a game plan. If you don't have a therapist, come talk to me to see how I can support you re-entering campus. But bottom line is we and I are here for you. You just call our main phone number and ask to schedule an appointment. And with that, I want to thank you so much for watching this video, and I hope you have a great rest of your day or night whenever you're watching this. And take care of yourself. Stay safe. Enjoy yourself, but stay safe. Take care.